Yeah, welcome everyone to the Beyond Consulting podcast. It's my pleasure today to start and host another episode. We have a very interesting topic today ahead around e-health and the future of health. And I'm very delighted to have Micaela with us. She is not only a renowned tele and e-health expert, but she is also a doctor by training. She is an advisor to governments, startups, and businesses. And she is the CMO of CUF, which is the largest private hospital group in Portugal, and they even been named as best private hospital in Europe in 2024 by the European Private Hospital Awards. Welcome to the show, Micaela.
Hi, Christian. It's a pleasure to be here.
And where are you joining us today from?
I'm in Lisbon at this very moment, and it is really very hot here. So I've darkened the room, so for that.
Yeah, we have a heat
But
wave.
I think it's also very, very hot over there where you are.
We have a heat wave here in Düsseldorf as well.
Mm-hmm.
And I think from a medical perspective, probably it's not the nicest thing to have, but it's very warm. We have air conditioning though here in the office, so it's quite okay. Yeah.
Yeah.
And Micaela, now that many of our listeners maybe think CMO has to do something with marketing, like the chief marketing officer, that's not the case in your case. In your case, actually, CMO stands for chief medical officer, and even for digital transformation. And that is what we want to speak about today. So my question would be a bit, can you enlighten us? What does Chief Medical Officer for Digital Transformation stand for, and what is it that you're doing?
Yeah, so actually, it is about how can we transform healthcare delivery, how we provide care, and leverage it by technology. So how can technology help us to increase access, to improve quality, to increase operational efficiency, to improve patient experience and professional experience? It's more about transformation actually of care, and technology is a big helper and facilitator here and leverage here.
So how does your job look like? You're looking into technologies from day to day, you're transforming things. What is it like?
Yeah, well, we obviously look at our challenges that we have. Just maybe to give some more information about CUF. CUF is a healthcare network. We have over 24 hospitals and ambulatory clinics. Last year we saw more than 1.3 million unique patients, so it's quite big. And of course, we have a lot of challenges, challenges that have to do with patient flows, that have to do with workforce, with operational efficiency, and we look at these areas and look how can technology help us here to improve. We, for instance, reviewed our acute care pathways and redesigned it with a digital front door where patients, through our client app, can do a symptom checker, and in the end they will receive a recommendation which is a medical grade recommendations as what level of care they should choose in what period of time, and we map our services so that they get access to these services in the right and the timely manner. This is one of the examples we created. We have a dedicated medical team in a digital first healthcare delivery unit, which is called CUF Digital, where we have doctors that, for instance, do specific video consultations for acute, non-emergent, non-urgent care. We even do telemedicine within our EDs, so in order to increase capacity as needed. So lower acuity patients that come to one of our 12 EDs may be offered to do a teleconsultation, which is enhanced by digital medical devices to do a proper physical examination, and thereby we can increase staff when we need it, with a remote distributed team of medical doctors that can step in when waiting lines increase. We use, for instance, for surgery, ambulatory surgery follow-up. We have a team of nurses that are supported by a voice bot that will phone the patients and will leave only those patients that really need care, intervention, attention to the nurses. So
So
this is how we rethink. Huh?
So that's just to elaborate, like, not sure if everyone is aware what EED is, but what you said is the patient is basically on the floor in the station, and the AI bot calls them and speaks with them if they would need any care, and then the nurses know who needs more attention, or how can we imagine this?
Yes, so we are talking about our now about the surgery follow up. So imagine you are doing an ambulatory surgery in one of our units, and you are discharged. And in order to follow up on you to see if everything is going smooth and right, and if there are no complications, you will in the 24 hours after, you will receive a phone call. This phone call is done by Clara, our voice bot, and she is going to ask you questions, whether you have pain, whether you have fever, whether you are feeling well, whether you have any doubts, and if everything is okay, the nurses don't need to call you. But if it is, if there is any doubt, if there is any red flag, then they will call you and will then take care and do the right steps in order to follow up on this and to care for this. And this is how we can do. So you see, we in the first 8 months we did more than 13,000 follow-ups. It's a way to scale a service, a clinical service, which otherwise would be tough, because workforce is scarce, and on the other hand, it is also much more rewarding for a nurse to step in when it is really needed than to be, like a call center person who is just ringing to people to know that everything is going smooth. So this is where the nurse is going to add value when there is actually something to clarify or a problem to fix.
I find it fascinating how you describe it, and it's like automating on the one hand, but on the other hand, maybe also freeing up those nurses for really sort of like cases where they can bring in those skills. Now, I mean, one thing we hear a lot is this term human-centered care. Yeah.
Yeah.
And of course, the patient is in the middle. In your eyes, what does it really mean? Yeah, when you select digital tools, or you maybe discuss AI use cases like the one you've just mentioned, or even like remote care. Yeah, how do you basically make the choice of which areas you bring technology in, and let's say in a mean way replace humans, but also of course automate it more, and get technology basically to take over certain things?
Yeah, basically, there are two, I would say, two dimensions. On the one hand, and very much from the patient's perspective, is to empower patients to have access. And for instance, the symptom checker is a good example. So if you have a complaint, if you are not feeling well, you have a digital tool on which you can trust because it's medical grade. It was curated by an institution that you trust, and you can get a guidance and recommendation and also literacy through that tool, and you are not dependent on that somebody has time for you, that you call a line and somebody's going to pick up, or that you have to go into choose yourself and go into a physical unit and then wait there that somebody is going to spare time for you. You can do it on your own. So this empowers you. And then on the other hand, we connect to the right service. So from the other point of view, obviously, so technology can free up time for healthcare professionals, and this time, if we do it right, we can use it to enhance the human connection. And therefore, you have to know, so what is the value that technology can bring in, and what is the value that the human actor can bring in, from an emotional, empathic point of view, but also from a technical point of view. So technology already can do a lot of things, but some things it is not yet able to do. So and to finding this out and to pinpoint this and then to transform this in a meaningful touch point within the care journey. This is this is what I'm interested in, and what I'm lucky because I can do that in my professional life. So
And super interesting. And that symptom checker that you described, it's available for everyone or just for the patients in your hospital? Is it something that even maybe international patients can draw in? How is it working?
Yes, it is. It is part of it is embedded in the client's application. The client's application is freely available in the stores. I must say I'm not sure. So international patients that live in Portugal or that are in Portugal and download it here can access to it. I'm not sure if it is available in all countries in the respective app shops. I'm not sure of that. But yes, then it is for free, so you can use it. You must authenticate yourself to a certain point, because, and I will explain it to you. You need to have an electronic medical record within COOF. So because the information that is generated, it is already a clinical history that is taken. Okay, so it is quite a comprehensive clinical anamnesis that is taken by the app, and this is clinical information that goes into the patient's EMR, because if there is an encounter with a healthcare professional, then this is important information and actionable information that can be already used. And even in the history of the patient, it may have important information there. So yes, but the usage of the app, whether you go then to COOF or not, is for free.
Okay, it makes a lot of sense. And just out of curiosity, what are the things that people check on most? So when do they actually use the symptom checker? Do you have some feedback from the data also in the end that you say, okay, this is what we see, what people use it for, and then of course we maybe feed that back to the nurses or to enhance the app?
Yeah, so it's a provider that we have a provider of this application, which is actually a German-born provider. It's Ada Health. You may have heard of them, and so we have of course the information that that is collected, but we also get some information about, I would say, population health information. So we can see that in certain periods of the year, there are some complaints, some symptoms, and some possible diagnoses that rise, and in other times they go down. It's a very broad area of clinical situations, but the most are flu-like viral infections, infections of the upper respiratory tract, urinary tract infection. So what is common is also common as an assessment in this app.
Okay.
Mhm.
So I think it's been a great example describing like what's possible with technology, and that might be even more like a lot more use cases
Mhm.
we can bring in technology. If you take it a bit higher, because I understand you're quite advanced at KUF with the electronic medical record, with the app, with a lot of things that you've described. Yeah? And we bring it up to a bit of a, let's say, European or country level. Yeah. What is it that actually is going to happen? What we'll see in the next years, and where do you think are the challenges of scaling all these digitalization topics?
Well, there is already a lot going on. Maybe I can just in different countries. There are different countries that are doing interesting things, and in some areas are quite advanced. Let me talk of the country that at this time I know best, which is here, which is Portugal, and I had the before being CMO at KUF, I actually worked at the Portuguese Ministry of Health, and within the Ministry of Health at the Digital Health Agency, which is called SPMS. And we there built up, we transformed, one of many things that we have done there is transforming a nurse triage phone line that existed since the late 90s here in Portugal, in order to guide citizens in when they need health. And we transformed this line into an NHS omni-channel contact center with a lot of with an increasing number. It's always increasing, obviously, because you start small and then you add and you grow. Digital health services, either clinical, but also non-clinical. And so, for instance, through our the Citizens app, you can access to your e-prescription. So e-prescription is here since 2015. It is universally used in the public system and in the private system, and it is provided by the Ministry of Health. You have your e-vaccine bulletin. So the whole vaccination process is digitized, which was really very helpful during the pandemic, as you may imagine. So you have your e-vaccine bulletin in your app, where you can see the vaccines that you had, but also those that are due. So you can see your lab results or your imaging results as a citizen, and you can have access to your citizens' EHR, so electronic health record, which is and here we can connect with what you're were asking about Europe. As you may know, there is an agreement in the EU to implement until 2030 an EHR with a patient summary. This patient summary is a collection of relevant relevant information like diagnosis, allergies, medication, implanted devices, and all this information is information that is semantically interoperable. So and according to catalogs, and so that you as the user, as a citizen, if you, for instance, need medical attention in another country, this information, with your consent or in an emergency situation also without consent, can be used in order to assist you. Then there is the cross-border e-prescription, so that you can go into another, travel through Europe and get prescribed medication with a digital process, and it is cross-border. So on a European level, I think there are a lot of initiatives, also initiatives regarding the structure from the technological point, but also from the semantic and content point. How EHRs should be. I think there are a lot of things going on. Many of, or probably a lot, the normal citizen is not aware of. Yeah, so I don't know whether I answered your question.
I find it fascinating. So I didn't know that, but I'm also not a specialist, of course, in that. I'm more coming from a mathematics simulation background and consulting background. But I think it's good if people know about all these things. And I mean, that is kind of, if I would interpret it from a data standpoint, you have a unified record. So you have some standardized data per person that you can pull. So, and that of course always is the beginning. Standardize the data objects. Yeah. Where will it go? I mean, what are some crazy things where you're excited about that we're going to see it maybe in the future?
Crazy things for the future.
Like if I ask my colleagues here and they say, look, we have of course a nurse shortage in Germany, and we have a lot of shortages in Germany regarding qualified labor. But robots will help us soon in the future. Yeah? Well, I'm always cautious and say, okay, well, imagine all those people in a hospital, would they actually love a robot taking care of them or not? Or, but that is just maybe just one thing that is also very, very tangible. Yeah, but there might be a lot more things like chipping, variables, topics that, of course, can even get the picture a bit more futuristic.
Well, just let me add one thing to the European topic. There is obviously also, and I think there is a lot of expectation towards the European health data space. So not only for care, but also for secondary use, for research, for innovation, development, and so on.
Can you just repeat it? I think there was some paper or something doing a bit of a crazy.
Oh, sorry. So the European data health data space, the European health data space. So, but going back to the question, I don't want to be a spoilsport here. I think people are always excited with new technology and gadgets, new robots, and so on. And of course, we will see a lot of innovation, and we will see a lot of things there. Um, but we have also and so healthcare is complex, and healthcare, it's not technology that will transform the healthcare. Technology will help to do things that we were not able to do before. So it is a means. It's not the solution for healthcare. It's not the silver bullet for healthcare. And so there are a lot of things that we have to tackle, and there must be we have to go advance, like when you look, for instance, at how the system is aligned. At this very moment, it is not aligned towards outcomes. It is aligned towards volume and production. And also the financing system, the reimbursement system, is built on not on outcomes, on value. It rewards production. And when we look at where technology probably yields more value, is actually in reorganizing, in redesigning, in reinventing how care is delivered. And when we have chronic diseases, for instance, and this is something that is consuming about 80% of the costs of healthcare, then we need systems that really reward prevention, that reward prediction, proactiveness, that reward continuous caring and monitoring of diseases. And technology is already offering a lot of opportunities, and in the future it's real. Think of artificial intelligence and its capabilities that we surely will use in the future, in the prediction area, in the personalization area, and so on. But at this very moment, we have really to transform the system in order to support this, and in order to promote this, because otherwise you will have a fancy digital app, or you will have a fancy robot, or so on. If the system is not ready to use it and to integrate it in its workflows, it won't be able to really take. It would just increase costs without really changing the things that have to be changed.
I think it's an important point. So you can add, of course, more technology. As you say, it increases cost. But what is then the benefit? Some cases, maybe you need less labor, so you free up resources. But also, I mean, the point of where you say maybe it's in a way possible to reduce actually the number of cases when you actually think about using it, not when something is broken, but before, to have some prevention or treatments, and to have basically proactive healthcare. And I'd say, like, it's quite obvious, I would say, to think this way. So even in, let's say, if we look into industrial productions, there you always have the question: how do you do maintenance? Do you do interval scheduled, AI support maintenance, or do you basically do maintenance basically when the plant is burning and then you just replace it and start over again?
Mhm.
What are the trade-offs of those extremes? Yeah, and something in the middle, of course, then evolves. But what would you say is holding back the system, the healthcare system, to go in that direction?
Yeah, one of a very important aspect is how is the reimbursement system, the financing system. So if you are financing per volume, you are focusing on increasing the volume of your production, and what you focus is on your little piece of process. I'm talking from the provider side. You're looking at this piece of process that you want to increase the volume, and you are not looking neither at the outcome on the long run. So to say it bold, adding healthy years of life to people with quality. So you are looking at your piece of the process, not of the end-to-end process, and so this is something that promotes fragmentation, that promotes silences. So and the whole system at the moment is built on that. It is built obviously also on problems we had in the last century. We had mainly acute diseases. We had a lot of labor injuries and these kinds of clinical problems to solve, and we built a sick care system where we reacted to problems, and an episodic system. And this paradigm has to change because our problems are different now. Our challenges are different now. But happily, the opportunities and technology is here an important part of it, are also different now.
Now, I'm running a consulting network. And so the question is, of course, with all these challenges, where we need a paradigm shift, where do you see the greatest opportunity for freelance experts or project managers to support that healthcare transformation?
Well, I think it's on the transformation level, on this layer, and when we look at different industries and also at healthcare through the centuries, so it is really difficult to do a real transformation from inside the system, because people that are inside the system, they are inside the system where everything is aligned in an already established direction, and to think differently and to do things differently is really hard. And it's also it's even harder when you are already under pressure while doing what you are already doing. So I think consultants, they can they can do something very important. It's a starting point to help to question the status quo, and to help to develop a new vision, and then obviously build a strategy, help in the implementation, as I said, from a healthcare provider point of view. So people are very busy with doing what they are doing under big pressure. So it is difficult not only to find the mindset, to free capacity to think and to keep the focus, and their institutions and organizations, they need help. Yes, in the change management, because this all has also to do with a culture that you have to change. So, and this is the hard bit. And yes, specialized expertise is really important because basically this transformation is a transformation where you need multi-professional, multidisciplinary collaboration. And this is, this is a huge endeavor to do so.
And if you see, of course, coming people in with an external view, or at least being externals, so they can at least trigger the system from the outside a bit, for the transformation. Where would you say can consultants differentiate themselves? What sets good consultants apart from less good consultants? If you had to give one advice to our consulting work.
I would say I would say be humble when you arrive, because you may be highly specialized in an area and with a lot of expertise, but it is you have also to learn about the organization and to acknowledge that people are there working, they work there, and they know the business very well, they know the hardships very well, they are also bright and have thought about the problems and how to solve the problems. Often they have already tried, and so they are also experts. So this is important. And then I think you can one very important bit is to ask the right questions, because then you kick off the discussion, and then you start questioning the status quo by asking the right questions, and to identify together with those that know this business maybe for 20, 30 years, to identify the gaps and to build something new in a collaborative way. This is what because otherwise it is something that you deliver and nobody is going to look at it or to put it into practice, or if you do not engage, and if it is not felt, the change is not felt as something where people have also ownership, then it will be difficult to be successful. So don't know whether this
In the end,
answered
it
your
always comes
question.
to you need to make results happen, and the execution is the hard one.
Yeah.
So, well said, I would say. Micaela, it's been a pleasure. For the last part, I've prepared 4 rapid shoot questions. Yeah.
Right.
Shall we quickly go through them?
Yeah, let's go.
So, what is one healthcare trend we are underestimating?
Well, I would put it. Sorry to to boycott your question, but I would put it in another perspective. I would say we underestimate the threat of sustainability of our health systems. So and I think we underestimate that these systems may implode, and then all the nice ideas, all the nice technologies, all this innovation will not be successful, because we are going to struggle with very basic things that are not possible anymore to do as people expected to do. So financing is a big problem, and workforce scarcity is another problem. If you don't have money and you don't have people to do things, you can have nice ideas, but nothing is going to happen. So,
thank you. One healthcare startup everyone should know about.
So I would name Sort Health. Salt Health is a telerehabilitation, telephysiotherapy startup that is now moving also into other health areas, and to look at them and the way to look at how they evolved. I think it teaches you a lot about healthcare, about digital transformation, about how the difference between a digital native data driven healthcare provider and traditional healthcare provider. So I invite you to look that up and to look not at what they are doing today, but how they achieved where they are today. So this is really teaches a lot. So we could have a whole podcast
Okay, yeah, maybe we have
this as
another
an
one.
example. Yeah.
What is one myth about digital health that drives you crazy?
Well, that's straightforward. The sentence that IT departments will drive digital transformation.
Who's driving it? Sorry to ask.
Yeah, it's not IT departments, because IT departments, they won't transform. They will care for, because transformation is something, is a transformation of culture in the first place, of vision, of strategy, of governance. And technology will then support this and will maybe accelerate some things, but it won't transform. It's a means. It's not the solution.
Okay, we have two more questions to go. What is
Yeah.
your idea that shaped your thinking on healthcare?
Well, there is a concept that that was something that opened my mind, that I'm really fond of it, which is by Clayton Christensen, which is the concept of the job to be done, which is so very briefly, it is really to distillate the task that has to be executed. Um, um, and often people say, now what healthcare is concerned, so patients need to see the doctor. What patients expect is to have easy access to a doctor. And looking at it, it's not, nobody wants to see a doctor. People want their health problem to be solved. And we have to distillate what's the problem. And from there, then we can imagine a whole bunch of solutions. And this is also where then is opportunity to innovate and to implement, to create digital touch points and so on. But if you are not able to really pinpoint the job to be done, you will never be able to think something new, because you are stuck to what is the usual thing. It won't fly. So
Lastly, if you had 30 seconds with every minister in Europe, with every health minister in Europe, what would you tell them?
I don't know. I would tell them, you are insisting in financing a system that was built for the last century, and you are not building the system that we need now and that we will need in the future. And then I think I would need more than 30 seconds to argue why I think that.
Micaela, thanks a lot for joining today and your refreshing perspectives on how building a new system and also the technology aspects. I think I personally learned a lot. Thank you a lot for joining us today, being our guest. And of course, we provide probably that link and also the company names you've mentioned in a comment below. But yeah, thanks again. It's been my pleasure. Really, really
Yeah.
great having you today.
It's my pleasure. Thank you for the opportunity. And I really enjoyed this conversation.
Thank you, Micaela.